How to have safer sex. Sex is an important part of life. Whether you are a virgin contemplating your first time, or a more experienced person looking for a new partner, sex can be both exciting and a little nerve-wracking. Practicing safe sex means that you can more easily enjoy having sex with a new partner. You can feel confident in the knowledge that you're protecting your body and your health. You need to learn to stay safe when it comes to sexually transmitted infections or diseases, STIs or STDs, unwanted pregnancies, and other risky sexual behaviors. Remember, you need to take care of both your mental and physical health. Avoiding STIs. Use latex condoms. Male condoms should be used for any kind of sex, including vaginal, anal, and oral contact. The male latex condom is easy to use, efficient and cheap. It is also widely available for free at Planned Parenthood locations, other counseling services, and many schools. Consistently and correctly using latex condoms during sexual intercourse can reduce the risk of STIs and pregnancy with up to 99% reliability. If you're allergic to latex, you can also use polyurethane condoms, which offer some protection against STIs. Natural or lambskin condoms offer reliable protection against pregnancy, but the material isn't fine enough to prevent the transmission of some infections, making them less reliable for that purpose. Make sure to properly place the condom on the erect penis. Doing this together can create a more intimate experience. Remember, both partners are responsible for safe sex. If you are sexually active, you should always have a supply of condoms on hand. Make sure to regularly check the expiration date, too. Condoms do not typically break when used properly, however, if the condom rips or tears during intercourse, make sure that both partners get tested within 10 days. Consider using a female condom. Female condoms can be used for vaginal penetrative sex. They are effective against most STIs and can help reduce the chances of pregnancy. Though the failure rate is higher than with hormonal contraception, female condoms can be very effective when used in combination with other protection. 1. You should never use a female and male condom at the same time. That can cause friction that will tear one or both of the condoms, making them ineffective. Make sure to carefully read the instructions on the packaging. You want to ensure that you properly insert the female condom. You will insert the female condom in a similar manner as inserting a tampon. The penis should be inside the female condom during intercourse. It is unlikely that the female condom will break if used correctly, however, if there is a tear, make sure to visit your physician to get tested within 10 days. Use a dental dam for oral sex. Dental dams are latex sheets, or condoms that have been cut open to form squares. When used correctly, dental dams have been proven to reduce the risk of passing blood and other fluids to the mouth from the genitals. These are effective in preventing STIs and HIV. You can use them when performing oral sex on both the vulva and the anus. 2. Make sure the latex doesn't have any holes, tears, or other damage. Rinse off any cornstarch if necessary, as this can promote vaginal infection. Cover the genitalia or anus while performing oral sex. Never switch back and forth between the vagina and anus without first replacing the dental dam. Discard after use. Try a lubricant. While friction can be a pleasurable feeling during sex, it can also heighten the risk of infection. Friction is often the cause of broken condoms or dental dams. To prevent too much friction, try using a lubricant during intercourse. 3. Make sure to read the ingredients on the package. Don't use an oil-based lube on a latex condom. It will break down the latex. Instead, choose an water-based lubricant. Silicone-based lubes are also a good choice. You can also use lubricants to make dental dams more supple and less likely to tear. Find other ways to be intimate. You and your partner can engage in sexual activities that carry absolutely no risk. Be creative and explore new ways to turn each other on. You can use words and fantasies to arouse one another. Some no-risk sexual acts include 4. Phone sex or sexting. Mutual masturbation. Cybersex. Try low-risk activities. Anal and vaginal intercourse are considered high-risk sexual activities. The risk of infection when having intercourse anally is greater because the skin at the anus is thinner, making infection and disease transmission more of a possibility. Likewise, sexually transmitted diseases and infections are transmittable between the mouth and the genitals, making unprotected oral sex also a risky behavior. You can still be intimate without engaging in intercourse. Talk to your partner about trying out some new sexual activities. You could try 5. Deep kissing. Fondling. Experimenting with sex toys such as dildos or vibrators. Keep sex toys clean. Always wash them between uses, and never use one that you're not sure is clean. A weak solution of disinfectant in a bowl of water is a cheaper option. Rinse the toys well and be sure to dry them before storing them in a sealed bag in a clean and dry environment. Do not share sex toys with partners you aren't fluid bonded with, since you can spread infections this way. Consulting your doctor. Get tested regularly. Go to your doctor or a free clinic regularly to get screened for HIV and other STIs. Get tested together with a monogamous partner before deciding to stop using protection. You should continue to get tested regularly even when you are in a relationship, to be on the safe side. It is better to get tested than to unknowingly be infected with an STI. 6. Ask your partner to go with you if you're nervous. It's not lame to request that your partner do this enthusiastically and willingly. If your partner doesn't want to go together, ask them to go on their own and share the results with you. You can't try saying, "I respect your need for privacy. But please remember that this affects both of our bodies and health. We need to share this information with each other." If your partner is not willing to practice safe sex, find another partner. 7. Learn specific symptoms. Educating yourself can help keep you safe. One of the best ways to protect yourself is to boost your knowledge. Take some time to learn about different STIs. You can learn about methods of contraction and symptoms. Your doctor is one of your best resources. Ask your doctor for some information or look at a reputable website. 8. For example, you should know that one of the most common STIs, chlamydia, often has no symptoms. For that reason, it is often unknowingly passed to others. Ask your doctor to test for all STIs before you sleep with a new partner. Genital warts are another common STI. These warts are easily spread by skin-to-skin contact. The flesh-colored bumps may look similar to cauliflower. Your doctor can help you find the best treatment plan. Many STIs don't have visible symptoms. However, if you see any abnormalities on your partner's genitalia, you should avoid having sex until they have visited the doctor. Know your body. If you notice any changes in your body, visible or not, don't hesitate to contact your doctor. You're always better safe than sorry. Get vaccinated. One of the best ways to prevent certain STIs is by getting vaccinated. There are currently vaccines that can be used to prevent hepatitis A and B, and human papillomavirus, HPV. Talk to your doctor about whether these vaccines are right for you. 9. Females between the age of 9 and 26 should be given the HPV vaccine. It is given in 3 doses over 6 months. The CDC states that this vaccine is safe for all women between those ages. The HPV vaccine is also recommended for boys, given at age 11-12 years. The CDC recommends the hepatitis A vaccine for all children, men who engage in intercourse with other men, and illegal drug users. There are many populations who should receive the hepatitis B vaccine. These groups include children under 19 who have not previously been vaccinated, intravenous drug users, men who have sex with men, individuals with HIV or chronic liver disease. Get treated. Part of having safe and responsible sex is making sure that you are not passing a disease to your partner. If you have contracted an STI, you need to make sure that you receive the proper medical treatment. If you receive a negative diagnosis, ask your doctor about the best treatment option for you. 10. For example, maybe you learn that you have contracted gonorrhea. Your doctor will prescribe a course of antibiotics as a treatment. For this, and any infection, Make sure to take the medicine exactly as instructed. Ask your doctor if you have any questions, or are concerned about side effects. Tell your partner. You need to say, I need you to know that I was recently tested for STIs. I have gonorrhea. You need to get tested as soon as possible. Ask about high-risk sex. You might find yourself in a situation where you want to knowingly engage in high-risk sex. For example, maybe your partner was previously diagnosed with HIV. Talk to your doctor before engaging in sexual activity. 11. Ask a lot of questions. You can say, my partner is HIV positive. What extra steps can we take to make sure that I remain negative? Keep the lines of communication open. If you or your partner have questions, make sure to ask. It is possible to have a healthy and happy sex life with someone who has tested positive. You just need to make sure that safety is always part of your routine. Tips. Do not use petroleum or oil-based products, as these will weaken the condom. There are lots of good water-based lubricants on the market. Carry condoms with you just in case, but try to avoid keeping them close to your body, for example in your wallet, as heat will accelerate the breakdown of latex. Sex includes other options besides vaginal and anal sex. Manual and oral sex also allow for sexual activity without the need for contraception. Bear in mind that diseases like HIV can still be transmitted over the smallest injuries in your mouth, for example. Use a condom to be totally safe, especially if your partner has not been tested for HIV recently. It is a good idea to put on a condom as soon as possible. While traces of sperm in Cooper's fluid, precum, are believed to be unlikely to cause pregnancy, this is essential to prevent the spread or contraction of STIs. In the UK, condoms are available free of charge from family planning clinics and all forms of contraception are free on the NHS. Warnings. Never pleasure yourself or your partner with fruits such as bananas or other forms of phallic-like objects that are not solid. Failure to take this into account may lead to a situation where medical professionals may need to be involved. There is no sex without some form of risk. No form of contraception is 100% reliable. Not having sex is the most reliable way to not get STIs. Sexually transmitted diseases do not discriminate on grounds of marital status, age, sexual orientation, class or skin color.